Welcome to another great edition of Dr. J's Health and Wellness Tips. Tonight I'm going to be speaking about a subject that is very important and a question that I'm asked very often by many of the patients who come here. And that's, when should we use ice versus heat therapy? And I'd like to first mention that whenever a person sustains an injury that involves traumatic force to the body, or any type of acute injury, or any type of fall, faulty movement, sprain, strain, sports-related injury, any type of contact, or any type of physical force that's imposed upon the body, ice would be the correct choice of therapy initially, because ice will serve two purposes. Number one, it will help reduce pain. It's a very effective analgesic. And number two, it will reduce inflammation. So for any type of acute trauma, or any type of pain that begins suddenly or rapid in onset, where there's visible signs of swelling, the correct thing to do would be to put ice on the area. And at the clinic, I recommend and sell these ice packs. What we typically do with this ice pack is we put it in the freezer, and after about an hour and a half it's ready to be used. Once it comes out of the freezer, it will still remain flexible. We put it in a Ziploc because we don't want to put this directly on the surface of our skin because we can burn our skin. So we put this in a Ziploc and then it will go directly on our body. The typical duration of ice therapy, also known as cryotherapy, would be 15 minutes on and 30 minutes off. So you'd have the ice pack on for 15 minutes and then you would take it off for a period of 30 minutes to allow your body to recover. In the event where a person suffers from chronic pain due to muscle tension, poor posture, degenerative changes in the body, disc herniations, osteoporotic conditions, osteoarthritic conditions, or any type of condition where there's a great deal of tension that builds up in the body, heat would be the recommended course of therapy, in addition to manual therapy, which we offer all our patients. So the heat therapy can be used in the form, again, of this gel pack. This can be put both in the microwave and also in the freezer, or one can use a heating pad. And in the heating pad, of course, you plug it into the wall. There are typically 3 settings, low, medium, and high, and the person can choose either a low or medium setting. The high is a little bit strong, and there's always a risk that a person can burn their tissues if they leave it on high. One should never sleep with a heating pad because it can, and it most probably will burn your skin. I see patients who come here who sometimes they fall asleep with the heating pad on and they come here with burns on their back. So never, please, sleep with the heating pad on your back. Okay? So this really describes the difference when one would use heat versus ice therapy. For any type of acute injury or trauma or a fall, sprain, strain, muscle tear, sports-related injury, or any force that is imposed upon the body, use ice therapy. For muscle tension, chronic pain, and degenerative conditions, heat seems to work very, very well. I hope you enjoyed this segment, and stay tuned for more amazing episodes of Dr. J's Health and Wellness Tips. Feel great today with Dr. J. You can reach me at 514-707-2222 or visit drskolarchiro.com. Thanks and have a great day.